Hi all, good morning. Am I audible and my screen is visible? Please confirm everyone.
Yes, ma'am.
Okay. So hi all, good morning. Welcome to DurgaSoft Medical Coding Seminar for today's session. So myself, I'm Sunitha. I have total of 10 plus years of experience into the medical coding field, and I have worked in companies like Optum, R1 RCM, and IKS, and in those companies I have worked in different specialities with the different roles like a junior role and a senior medical coder and an auditor and a trainer. So today we'll see the seminar on medical coding. So what is our today's agenda? So today's agenda is introduction for the medical coding and who can take this course, where does a medical coder will work, and what is medical coding, you have to know about this, and RCM cycle also you have to know, and why it is important, and what are the list of the companies and job locations where does the medical coder will be hired in the companies, and what is the salary. So all this will be covered in our today's agenda. So if you're interested, you can introduce yourself with your name and your qualification. Let's start, students. You can introduce yourself, ma'am. Your name and your qualification. That is enough. Hello. Yeah, just your name and your qualification is enough, ma'am. Can
Yes,
you introduce?
ma'am. My name is Naveen. I'm studying B Pharmacy third year.
Okay. Yourself, your name is Shravani. Okay. What about others? All are B Farm or any other graduates? Can you introduce yourself? Shareem, Mangesh, Suhas. At least you can give your intro in your chat also. That's enough. Just want to know about your qualification. Okay, Shareem. BSc completed. Mic is not working. You can text it in the chat box, Mangesh. It's not that you can talk. You can at least give your qualification in the message.
Hello Sunita, I'm BIT. So I worked as a Java developer, but I worked in a medical coding field. Already working, uh, develop
Okay,
an application for medical coding
you're working as a
as a Java developer,
okay.
but the application is used for medical coding. So medical coders use the application which is developed by me and my team.
Okay. So I mean, like, why you want to come back to medical coding field or what?
So I'm not planning to come to medical field. It's just like in my day-to-day schedule, I worked with medical coders. So that's why I joined this seminar. I thought,
Okay.
uh,
Okay, fine. Okay, so let's start this session. So, who can take this course? So, first of all, we should know like who all are eligible for this medical coding course. So, the first and the foremost importance is for the life science graduates. So, any life science graduates like who are completed this B Pharmacy, PharmD, or BSc in biology, zoology, microbiology, biotechnology. So all this comes under the science graduates. So who have completed the graduations from the science group, so they are eligible for the medical coding CPC program. Not only life science graduates, but also for the non-life science graduates also are eligible for this medical coding CPC program. Because nowadays, as we are getting so many projects in the medical coding, so they are hiring for the non-life science also. But non-life science they are hiring, but they should have the knowledge of medical coding. That means they have to complete the CPC certification. If you are a non-life science, let's take like you have completed some BCom or BBA, some BSc computers, like that you have completed. Okay, so you can also take up this medical coding. After completing the medical coding CPC certification, once you are a CPC certified, that is enough to get a job in the medical coding field. So this is the thing, like what are the necessary for the medical coding. So life science, non-life science, and also like freshers and the final year students. So final year students in the sense like who have recently passed out every year, like let's take in the year 2025 who have passed out with the graduation of B Pharm, BSc computers, whatever. So final year students are also eligible for this medical coding CPC certification program. So life science, non-life science, any freshers, final year students, all these students are eligible for this CPC certification. Now, let's like where does a medical coder work? We'll see this. So we have seen what are the requirements for the medical coding, like who all are eligible. Now, where does a medical coder will work? Where does a medical coder will work? Let's see that. So, in other countries like US or Dubai, like that, in other countries, the medical coder will work in the hospitals. So, for this medical coders, they have a separate setup. It's not like um, you have to work in the operative room, nothing like that. You have a separate setup for the medical coders in the hospitals in other countries. And coming to India, where you are going to work, not only India, but also in other countries, you are going to work in the companies, healthcare companies. Like we have so many companies have come for this medical coding, like Omega, Episource, Miramed, Optum, like that. You have so many healthcare companies have come for this medical coding. So in India and other countries, you are going to work in the medical coding companies, which are nothing but the healthcare companies. Okay, nowadays the medical coding projects are getting in the IT companies also. Let's take like Cognizant is there. Nowadays, Cognizant is also hiring for the medical coders because we are getting so many projects in this medical coding field. So you are going to work in the IT companies also. Not only for the medical coders they are hiring, but also if required, you can also move to the IT field also if it is based on the requirement. And then you can also do the work from home once you are an experienced candidate. As a fresher, there is no availability of work from home. But once you are an experienced person, you can also do work from home. And also hybrid model is also there for the medical coding. So like this, we have all the workplace locations for the medical coders. Now, let's see what is medical coding. What is medical coding? So, medical coding is the translation, the conversion of the patient's health information into the alphanumerical codes. So, the complete patient's information, whatever is there, it is completely converted into the ICDs and CPTs. Now, let's take one example here. a patient is having abdominal pain. So this abdominal pain, it is converted into the alphanumerical format, which is nothing but R10.9. So as a medical coder, what is the job? You have to convert this problems into the code form. That's it. Okay. So abdominal pain, what is the ICD code for that? R10.9. So this is nothing but a diagnosis. Now let's take, we also have surgery coding also. Every person will undergo like, if required, they will be undergoing some surgeries. So that surgery is also converted into the numerical form. So which is nothing but the CPT. So what is medical coding? It is complete conversion of the patient information into the alphanumerical format. Now, how the process will be, like we have seen what is medical coding, right? It is the complete conversion into the alphanumerical format. Now, from where it will start? From where it will start? Let's see the cycle of the medical coding. See here, if we see, first the patient will visit the hospital, and in the hospital, why a patient will go? Because patient will have some problem, like let's take fever, chest pain or fracture. So patient will have this problem, and patient will be visiting the hospital, and physician will evaluate the patient, and then he will give some diagnosis. Okay, you have so and so problem, and he will order some test. So he will write all these things in a prescription. So he will write everything in the prescription, right? Like this, if you see, we'll go to the hospital, they will write everything in a prescription format. So this is converted into the electronic health record. So this is completely converted into the electronic health record by the medical transcription people, and that is received to the companies, medical coding companies, where the medical coders will convert all the diagnosis and surgeries into the ICD and CPT format. Nothing but alphanumerical codes we are converting. So we will be receiving the patient information, and we will be converting into the ICDs and CPTs. See, here also you can see like ICDs and CPTs will be converted. Okay. Next, where does this will go? Where does this will go? This will goes to the insurance companies. So this will go to the insurance companies. Like we have so many insurance companies, like private insurance will be there, government insurance will be there, like Humana, United Healthcare. So this insurance companies will pay to the providers, nothing but the doctors. See, in the US and other countries, they will not call doctors. They will be called as physicians or providers. So the insurance companies will pay the amount to the physicians. So this is the complete process of the medical coding. Okay. So a patient will visit the hospital, and the doctor will give the information, patient information, which is converted into the coding form, nothing but ICDs and CPTs. And then this will be received by the insurance, where the insurance will pay the amount to the providers. So this is all about the medical coding, and we can see all this in the hospitals. Okay. So this is nothing but we will call as a RCM cycle. So all this process, we will call it as a revenue cycle management. So all this process we will call as a revenue cycle, where you can see in the healthcare companies. Healthcare companies, we can see this. Let me explain this RCM cycle, how it will be in the US and other countries, and nowadays it is also there in the India also. So three persons are very, very important in this RCM cycle. One is patient, second one is the provider, and then third one is the insurance. See, in India, like how it will be, like we'll go to the hospital, we'll pay the amount to the reception over there, right? And then we will receive the service. But in US and other countries, the insurance will pay the amount to the providers. They will just have the insurance card. They will have the insurance card. That's it. And they will be paying yearly for the insurance. And they will directly go to the hospital. The hospital people will just validate it. And then they will receive the service. And insurance will pay the amount to the physician. So just now we have seen how the process will be, how medical coder will assign and how the insurance will pay, right? So patient, provider, insurance will play an important role in the revenue cycle management cycle. So these three persons in the healthcare are very, very important. So what is RCM? RCM is nothing but like from where a patient will book an appointment. He will book an appointment in the hospital and then he will receive the service, and how a payment is received to the doctor, physician. So this complete process is nothing but a revenue cycle management. So how it will be, let's see. So first, patient will register in the hospital, like he will register with patient name, address, and the insurance, everything he will register in the hospital. And then the hospital will verify the insurance, whether it is active or inactive. The insurance is active or inactive, they will check. And then next, patient will visit the doctor and the services are rendered by the physician, and the services are rendered by the physician, and a physician will give some diagnosis and the treatment, and then it will be converted into the electronic health record, and then medical coders will give the alphanumerical code. This is where you have to do the work. But see, before that, how much of process is there? See, we are doing some work means we should know everything from where it starts till the end. It's not like blindly we are going and we are working. You should know the complete process. If somebody will ask, what is your work means, you will tell, yeah, I'm a medical coder. But how the process will be? If you will explain to somebody, then they will be like knowing, okay, this is the process. So not only to explain to others, but you yourself should know like what is the complete process of medical coding. You should, by yourself, you have to know how the process will be. So from the patient registration, insurance validation, verification, and patient will receive, and the medical coders will assign the codes. And then next step will be the charge capture, and then claim will be processed. Claim is nothing but the medical record. You are giving the codes, and it will be converted into the dollar amount. And then next comes the billing. Next goes to the billing, nothing but the insurance will pay the amount to the physician. Next will be the denial management. When does the denial management will come means sometimes the insurance will not pay the amount to the physician because according to the insurance that service might not be covered. So in those cases, the patient has to pay. So at that time, the denial management will come. Okay. So overall, the complete process of the RCM cycle is this one. And even if you see in some companies also, you can see RCM for the medical coding companies. Like let's take R1 RCM. So what is RCM means? This is the one. So from the patient registration to the physician will get the money is nothing but RCM, revenue cycle management. Even if you see like some like R1 RCM is there, 5K RCM is there, like that you have RCM in the name of the companies. So RCM is this one itself. Okay. Now next. So you are able to understand, right, everyone who are listening this session, what we are learning for today's agenda. Till here, you have any doubts? Hello? 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 You are there, everyone? At least you can uh, give a text, ma'am. Suhas, understanding, no doubt. What about others, ma'am? Till here, like what I was explaining, you're able to understand, or you have any doubts? Okay, thank you. Thank you for that. Now, like I'm telling so far, like what is medical coding, what is RCM cycle. Now, what you have to learn, what you have to learn to get a job into the medical coding. So first is medical terminology. So basic medical terminology is required. Let's take like for example, heart is there. Okay, heart we know, right? So this heart, you have other word also that is nothing but cardio. As a life science, it is easy for you who are life science graduates. But what about non-life science? They can't understand. So to make them to understand, you should know this basic medical terminology. Like what is heart? Cardio. Let's take stomach is there. Stomach. What we will call this stomach in the medical words? Gastro. So like this, the medical terminology, you should have an idea to get a job into the medical coding. So basic medical terminology you have to know. And then next comes the anatomy. Human anatomy. So if you take the human anatomy, you should know about each and every human system. Like let's take, you should know about the skin. Generally in our body, like overall our body is covered with the skin, isn't it? So how many layers are there in the skin? So you should know about this. And then next comes the musculoskeleton system. Like what are the muscles? What are the bones? What are the joints in our body? You should know about this. So all this will be covered in the anatomy. So human anatomy is the basic thing for the medical coding CPC certification program. Not only skin, musculoskeleton, you should know about the heart also, how the heart will pump, what are the chambers of the heart, how it will function, what are the functions of the heart. Like this, you also have about lymphatic system, brain. You should know about the brain anatomy. You should know about the spinal cord. So like this, everything will be covered in the human anatomy and physiology. Pathophysiology is nothing but like you like so in each and every anatomy like skin, musculoskeleton system and heart, so what are the diseases covered under that? So for those diseases only they will do some surgeries. Okay, so that is nothing but pathophysiology. So you should also know about the pathophysiology also. Okay, so all this will be comes under the medical knowledge, nothing but medical terminology. Next comes the very, very important thing, which is a core part of your job. So ICD 10 CM and CPT and then HCPCS. So what are all these three things? See, just now I told like we will be receiving the medical record and you will be converting into the diagnosis. Abdominal pain is there. This is just a diagnosis, ma'am. You should know the difference between diagnosis and surgery. What is diagnosis? Diagnosis is nothing but a problem. Surgery means what? They will cut the body part and they will do the surgery. That is a surgery. So you should know the difference between diagnosis and surgery. So the diagnosis coding is nothing but ICD coding. What is ICD full form? It is nothing but International Classification of Diseases. So all the diseases, every disease is covered in the ICD-10 CM. So all diseases you have to code from the ICD-10 CM. Okay, so diagnosis coding is nothing but ICD coding. And how the design of the ICD will be? See, now I have coded R10.9. How it is? You have alpha format and also you have numerical format. So the structure, see, suppose I'm wearing a dress. What are the components in my dress like dupatta, chunni, like the top and the bottom, right? So same thing, like how the design of the ICD is. It is nothing but alphanumerical format. Alphanumerical format. Let's take like for example, patient is having diabetics. What is diabetics, ma'am? Anyone? What is diabetics? Any life science graduates? I want my session to be little bit interactive. If you are not interactive, uh, it won't be good, right? So anyone, just try. What is diabetics? Hello, any life science graduates? Okay, it's okay. At least you can message me in the chat box. Um, um, Insulin disbalance. Very good. Yes. So if the insulin is not functioning properly, it leads to the increase of the sugar levels, which is nothing but the diabetic mellitus. Again, in that we have type 1 and type 2. So see here, patient is having type 2 diabetics. So what we are coding for this E level.9. That's it. Okay. So for a diagnosis, you are giving a code, which is nothing but a ICD coding. Similarly, we have other example, which is nothing but COPD. So what is the code for this? J44.1. So like this, we have to give the diagnosis coding. Now let's come to the CPT coding. CPT coding is nothing but surgery coding. Surgery coding is nothing but the CPT coding. So this is completely numerical codes. All numerical codes only you have. There is no alpha. Okay, again in this we have three types of categories like category 1, 2, 3. All these are nothing but the surgery coding only. Okay, so what is a surgery? What is a surgery? It's nothing but to treat a problem. The patient will be undergoing the surgery, like they will do the incision. Incision is nothing but cut, and they will do the process of surgery. Okay, let's take like for example, patient is undergoing some stent placement in the heart. So in the heart, some blockage is there. Okay, so they removed the block and they have placed one stunt. So for this stunt code, you have one CPT code, which is nothing but 30,000 series. Okay, so in this way, for a surgery, we have to assign the codes, which is nothing but the CPT, which is the basic, which is the basic as well, which is a very much core part of the job, which is very, very important for the CPC training also. It covers 80% in the exam for the CPC. Okay, so CPT is nothing but the surgery coding. Let's take here also you have one more thing, arthroscopy knee surgical. So what is arthroscopy means? Nothing but they will insert one scope in the knee. See, this is the knee where they will insert one scope and they will examine, and suppose if any foreign body is there, they will remove the foreign body. So you have a code for that. Like this, you have to give the CPT coding, surgery coding. What is ICD coding? Diagnosis coding. CPT coding is nothing but surgery coding. Okay, so these two will play an important role in the medical coding. Next comes the HCPCS. What is HCPCS? HCPCS is nothing but these are not surgeries or diagnosis. This is a non-physician services. Like it gives the information of the dosage of the drug. For example, A doctor is giving, let's take like one drug, which is nothing but ketorolac, and he is giving 100 mg. So for this drug, you have to give one code where you have to come and code from the HCPCS. Okay, it's nothing but it is the supplies coding or equipment. Okay, for example, patient is wearing some crutches or patient is in the wheelchair. So to indicate that patient is in the wheelchair bound chair, you are giving the equipment coding or the drug coding also. So all this will be covered under the HCPCS. Okay, so these three are the things you have to learn in the medical coding course. Okay, now we are coding, that is okay, all fine, but how you have to code it? You have to follow certain guidelines and rules. So for the medical coding, there are two organizations like CMS and NCHS. They have set up some rules. See, now like you are in a school or you are in a college, you do have some rules, right? Like you have to wear a ID card, you have to come in a formals. Same thing for coding the ICD and CPT. These two are the organizations. They have set up some rules. Blindly, we can't go and code. You have to follow certain rules. Those are nothing but the official guidelines, ICD, and specific chapter guidelines from the CPT. So all these guidelines I will be teaching. You don't worry. Okay. So all these guidelines are taught in this medical coding CPC program. Okay. And also the HCPCS also. So you have to follow certain rules. For example, let's take like patient is having HIV AIDS. Okay, so you have two types of coding for this. One is B20 and Z21. Okay, so when you have to code B20, when you have to code Z21. So these two codes are for HIV AIDS, but when you have to code, so you have to follow certain rules. There is some criteria to code B20. There is some criteria to code Z21. So when you have to code this are covered under this guidelines. You have to follow certain guidelines, which are nothing but the ICD coding guidelines. Same thing for the surgery CPT also. You have to follow certain rules. Let's take like patient has undergone stomach removal. So some cancer is there in the stomach. They removed the cancer. So how they are removing it, whether they are cutting or whether they are doing laparoscopy. So nowadays, some advanced technologies have come up to do the surgeries like robotic surgeries, laparoscopic surgeries. Open procedure is nothing but they will cut They will cut and they will remove entire organ or whatever. But nowadays, advanced technologies like robotic laparoscopy, they will not do cutting. Small cuttings they will do, and then they will insert one scope, and by observing in the system, very big systems will be there where they will observe everything and then they will do whatever surgery is required. So in this, less amount of bleeding will be there, whereas in the open, a huge amount of blood loss will be there. So that is the reason advanced technologies have come. So like this, what is open surgery, what is laparoscopy, you will be learning all these kind of guidelines in the CPT guidelines. Okay. So all these coding guidelines and rules we have to follow. We have to strictly adhere to this CMS and NCHS rules. Why? Because if we are coding as if our wish, it leads to the fraud and abuse. Over coding or under coding will happen. By doing this, what will happen means physician will not get a proper amount. Physician will not get a proper amount. For example, like you have one open surgery code, you are coding. Okay. But that was a laparoscopy. For this, there is some $100, but for this, $200. So instead of coding one code, you're coding other code, which leads to the fraud and abuse. undercoding or overcoding. So to control all this, you have to follow this coding guidelines. Okay. This is the thing. And then now I was telling like abdominal pain is that you are coding. From where you are coding? You have books. You have CPT book. You have ICD book. You have HCPCS. See, the very good thing is no need to remember all the codes. Everything is there in the book format. Okay. Everything is there in the book format. Like this, APC will provide the books, ICD book, CPT book, HCPCS, every disease, every surgery we have a code. No need to remember anything like abdominal pain, R10.9, headache, R51, like this. You no need to remember each and every code. Don't remember. You just need to follow the rules and guidelines because everything is there in our books, the coding and everything. But the thing is, you have to follow the rules like how to assign the code properly when you have to code. Like this, you have to follow the rules. So the tools, what are the tools? See, for medical coding training part, you should use the books. But when you go to a job, you will not use a books, ma'am. But when you go to a job, medical coding job, you will not use books. Then what you will use? You will be using the softwares like 3M software and ICD10data.com and Encoder Pro, Codify. So all these are the tools where you will be working when you will get a job in the medical coding. Okay, so far you will get a job. So under training, where you will be undergoing the training. So for the training purpose, you have to use the books. And when you will be working directly live coding, when you will do like this, you will be using the tools. So like 3M, Encoder, all these are the tools, software tools we will be using. Let's take like this is one of the tool, ICD10data.com. You have to search the abdominal pain and then you will get a code R10.9. Like this, you will be using the codes. Okay, and the tools, these are the tools. Now, once you have completed the medical coding training, you have so many certifications, ma, that is CPC, CCS, COC, CIC, CRC, CPB. So all these are the certifications which are provided by the AAPC and AHIMA. So all these are the US organizations, United States organizations. So they are providing this certification program. So once you have completed the training, you have to write this certification. Why I'm telling? Because nowadays, most of the healthcare companies, they are asking for the certification. You can also do non-certification. That means no need to do the certification. But if you do the certification, the most preference is for the certified coders only. Non-certified also you can go, but the salary will be very less. So that is the thing. Okay. So some companies, they will ask for certified. Some companies, they will ask for non-certified also. But I suggest to do the certification. And out of all this certification, one of the best certification is CPC certification, which is nothing but certified professional coder. Okay. So this is provided by the AAPC. So once you will do this certification, you will get job anywhere in the healthcare industry. Okay. Once you will be a certified coder, you will get a job in any healthcare industry. So one of the best certification is the CPC certification. Okay. Next, like how the career growth will be in the medical coding. So there is like a very huge and a high demand for this medical coders nowadays. And there are a lot of opportunities overall, not only India, worldwide. We have this medical coding in Australia also we have, but for Australia, you need to do that country specification certification. But once you are like an experienced coder, anywhere if you go outside country also, you will be like an experienced person and you have to write for that country specific certification. And you can also do the remote work also. And you have a very good salary also in this medical coding field. The salary package will be also increasing based on your experience. So one of the commonly asked question by every student, what even if AI will come into this medical coding, does it impacts the jobs? No, not at all. Not at all. So why? Because you should know why. So what even if AI will come in this medical coding jobs? Um, e Even though AI is into the picture, it will not impact. Why? Because sometimes the medical records are very complicated. You will be receiving the medical records. AI can't read completely. It gives wrong way of coding, which leads to the fraud and abuse. So complex cases, what will happen? AI can't read it. It will read and it will give the code. But all these are sometimes out of 100%, 95% it might be giving the correct coding. But what about that 5%? But that 5% human requirement is very, very important. 95% accurately it is giving. But what about that 5%? That 5% also is important to give 100% of the chart medical record. So for that 5% also human is required. So even though AI is there, it is giving 95% accuracy, but for that 5% also human is mandatory. So that is the thing. Even though AI has come up into the medical coding job, it doesn't impact anything. So medical coders are always required. And I would say this is a recession-free industry. This is a recession-free industry. And also every year the ICD codes and CPT codes will be changed. So AI will not understand that, even though it will give the coding, but it won't be accurate. It won't be accurate because we are going to follow the rules and we are going to assign the appropriate codes. Okay, so by giving a wrong coding, it leads to some loss, revenue also. Revenue loss will be there to the physicians. Okay, so always humans are required even though AI is there in the medical coding. Okay, it will not impact anything. It will not impact anything. 100% I can say this. Next, like what kind of job roles will be there in the medical coding? What are the job roles? So first, once you are like a CPC certified or whatever CCS certified coder, and even though you are not doing certification, that is also fine. Nowadays, companies are also hiring. That's a good thing that nowadays some companies are hiring like who have completed the medical coding training, no certification. Nowadays, companies are hiring this criteria also. So once you are like, you have got a job in the medical coding, what is your first role? First role will be a trainee medical coder. That is nothing but a junior level. So, okay. So this is the thing. Next, once you are an experienced person, so you will be giving a designation as senior medical coder. And then what is the next thing? Next will be the auditor. See, once you are an experienced person, now you are like, you have known like what to code and what to follow the client guidelines and everything. So you will be an auditor. That means you will be auditing the charts for the junior level. So you are a senior. Now, who is a junior here? This person. Okay. So whatever they are coding here, as an experienced person, as an auditor, whether they are coding properly or not, you have to check it. That is nothing but a auditor level. So like this, as your experience is going on, you can move to different roles. Okay. Next, you can also become a team leader. As your experiencing is increasing more, you can become a TL where you have to manage a team of 10 members or 5 members based on the client requirement. And also you should have a leadership qualities also, like to maintain a team, you should have some qualities like how to manage the team members, how to regulate the rules and everything. And also, if one person is not coming in the team, there is a more workload. How to manage that workload in between of those team members? Like this, you need to have the leadership qualities. There is nothing but a team leader or manager. And then later on, like if you want to become a director of the company, but for this you need to have a very huge skills, and you need to have lot of experience to become a director. Okay, so all these are the job roles in the medical coding. Okay, now next comes the important and the foremost thing, which is nothing but you're getting a job, but like what is the salary, ma'am? You might be getting a doubt. Okay, so the salary will be varies based on the experience. As an entry level, it will be like 16 to 35,000. But once you are experienced, like you will be in the mid level, 3 to 5 years, you'll be getting 25 to 60,000 salary. And also you can go to 85 to and so on based on the experience. Okay, as a fresher, it will be this is a common thing from 16 to 35. But once you are an experienced person, your salary will be increased. See, for example, you are staying in one company only. Will be the same salary? No. Why? Because like you are working 1 year in the same company, you are in the second year. Based on this whole 1 year, you're like how the quality is there, like how you are working and how your performance is there, they will be increasing the salary. So there will be a hike also. So even though you are in the same company for 10 years, you won't be with same salary, right? So, based on your performance and based on your quality and everything, and your skills, they will be giving the increment also. Okay. So, like this, even though you are in the same company or you are moving to other company, your salary will be going on increasing. It's not that you will be stick to only one salary. Okay. Now, one more important thing is institute certification. So nowadays, like so many, they are doing self-certification, but you should know the certification from the institute, which is nothing but like if you are certified from DurgaSoft, so it is a easy thing to get a job. See, let's take one person has done the self-certification. One person has done the certification from our institute and they are going to a company. Okay, so the preference will be the person who have completed the certification from an institute. Nowadays, companies are also hiring the persons who have completed the training program for the from the institute itself, medical coding academies. Okay, so there will be very less impact compared to the self. Okay, so I would suggest to do the certification from the institute itself. Okay, why? Because you will be getting a structured course, like what you have to learn. See, just now I told you have to learn medical terminology, ICD coding, CPT coding, everything. I mean, like a structured course will be there from the institute. And also you can take the certification from the institute itself. And also you will be knowing a standard knowledge and skills also. And also we will give the job, like we will be like intimating you like where are the openings and all. Okay, and also the companies will prefer who have completed the training from the institute compared to the self. Okay, so this is the thing, the importance of the certification from the institute. And also, like once you have completed the training and the certification and everything, we will be like preparing you for the resume also. So like as a fresher, like what are the things you have to fill up in the resume, and what are the skills and the knowledge you have got from our institute. So we will be keeping everything in the resume preparation. And also we will be make you people to prepare for the interview also. See, suppose while you are in the training itself, we have got one opening. Okay, so we will make you to prepare for the interview also, like what kind of things they will be asking in the interview, like a written test, technical, and the final discussion, what will be there in the written test, what they will ask in the technical round, like what kind of questions they will be asking, like anatomy, ICD guidelines. So we will be making you to prepare for the interview also. And then we will be also having a mock interview also. Once everything is completed, once you are completing this program, and once you are a certified, then comes all these three things into the picture, not before only. Not before only. Resume preparation and the preparation for interview and the mock interview. And suppose like you're somewhere like Chennai, Bangalore, you're attending the sessions online, we can have the virtual online. Or else like who are nearby the institute, we can also have the offline also. You can come to the institute where we will be conducting the mock interviews. Okay. Now let us see the list of medical coding companies. See how many companies have come up in the last 6 years. So many medical coding companies have come up, like Coro Health, PRC1, Coronis, STM Health, Access Healthcare, Logix, Gibbs, Claris, Athena Health. Like this, we have so many companies have come up for this medical coding jobs and so on. Recently also, some 2 to 3 companies have come up because we are getting so many projects in this medical coding field. Now coming to the job locations. So you might be having a question like where the job locations will be. So common cities in India are all over India, medical coding jobs are there, but the most common cities where we have medical coding companies means Bangalore, Hyderabad, Pune, Chennai, Gurgaon, Delhi, NCR, and the Mumbai. And then not only India, in other countries also, we have this medical coding jobs like USA, Canada, UK, Australia. But you need to have those country specific certifications. Okay. So that is the thing, the job locations. So this is all about the seminar for the medical coding. Now it's time for you. Where you have any questions, you can ask me so that I can clarify. So everyone who are listening this session, did you understand like what I was explaining about the medical coding and all those things? You have any questions, you can ask me. And also tomorrow, we are having again a demo session where I will cover about this topics like ICD, CPT, medical terminology, and what is a CPC exam pattern and everything. I will be covering tomorrow. So tomorrow also there is a demo. You can attend the demo. Okay. And now it's time for you. You can ask me questions.
Hello, ma'am. This is Mangesh here.
Okay.
Yeah. So regarding the HL7 and the CPC, they are interlinked each other or a separate one. And second thing, the coding part, we
One
don't
second.
have
Can
the
you repeat
medical
again? You were saying,
experience.
you
So
can you
means anatomy or physiology or so how much we have to prepare for that.
No, first you were telling the difference between CPC and something.
Yeah, HL7, health level 7.
Health level?
7. It is used
I
for
did not.
interoperability in healthcare.
I mean, you're working in any healthcare department.
Yeah. So
Can I
there
know
are
like that healthcare department?
yeah. So the thing is that there are radiology information system or laboratory information system, inpatient, outpatient, front office, pharmacy, dietary. So they have their own softwares and they need to communicate with each other. one system is defined in Java, second one may be in .NET. So that time the HL7 standards are used, and the standards I am using to develop and transfer and transform the data for one system to another system. But there I
See,
do not
that
require
is a
any medical
completely
knowledge.
different. See, what you're asking is completely a different thing from medical coding. That's a completely different thing.
Yeah, yeah. You are correct. So that's why I'm asking that in that I don't any medical knowledge, but in the CPC I do require medical knowledge. Is it like that? Means anatomy or
Yes,
physiology
yes,
or
yes,
uh,
yes,
and
exactly.
do
So,
I need
mm,
to read it, mug it, or remember the coding in the exam? Means will they ask the
see, in the
suppose
that's what
XYZ is
I
the code
told.
for fever.
That's what I told. For fever, you have a code.
So do
No
I
need
need
to
to
remember the
remember?
code. No, that's what I told in the seminar. No need to remember any code
So in
because
the exam, what
everything is
will they
there in
ask
the
in
books
the
and softwares.
certification? Yeah, yeah. So in the certification examination, what will they ask? The question related to what?
That will be covered in the tomorrow session. What you are asking,
Hello.
like in the exam, CPC certification, how the exam will be, and is it a open book exam or what? All those details I will be explaining tomorrow. And no need to remember any codes. You just need to have
Okay.
the knowledge of medical coding, like anatomy, ICD guidelines. You have to follow certain rules and guidelines. This is enough.
Okay. Okay. Thank you, ma'am.
Okay. Okay, Shravani and a few are there. Like you have any doubts? Ekta, Mangesh, Sharim, Shravani, Suhas. Is everything clear to everyone in the session? Is everything clear? You have any doubts? How academic excellence matters? As I'm not good as topper, not scored even. No, no, you no need to worry. Who is this person? Was asking something. Sharim Khan. Okay. See, Sharim Khan, it's not about the percentage. Once you are a CPC certified, that is enough, and you are having a good knowledge of this ICD guidelines and anatomy to crack the interview. That is enough, ma'am. Least bothered about the percentage. Okay. What technology is used in coding, ma'am? We have specific tools we will be using. You will be also undergoing the training for those tools in the companies. They will be giving the training for that. Okay. Okay. Still anything else you need from my side, or you have anything so that I can wind up the session and we can connect tomorrow? But tomorrow's session is at 8 p.m. Hello? Okay, okay then. Have a good day, everyone. We'll connect to tomorrow. Thank you everyone for joining. Let's connect to tomorrow at 8 p.m. Thank you all. Thank you.